Welcome back. A healthcare ultimatum. The House expected to vote this afternoon on the Republican plan to repeal and replace Obamacare. The impact will be felt beyond Main Street. Joining us right now is the CEO of Hologic, Stephen MacMillan. And Stephen, it's great to see you. Thanks so much for joining us.
Thanks, Maria. Great to be here again.
Yeah, great to have you back. We've talked so much about your growth story at Hologic and the 3D mammography. You just did a deal with Cynosure, which we'll get to. But first, tell us about this bill and how it may impact things for you.
Oh, you know, at the end of the day, obviously, as a CEO, our jobs are to figure out how to navigate regardless of the environment. We've navigated through Obamacare, but I think, as we all know, there were a lot of things put in that bill that ultimately are coming home to roost now. And particularly, I think the cost to the middle class, when you look at the premiums going up, something does need to be done. You know, I think a lot of our CEOs, we're all hopeful that something will get done that will keep coverage for folks, but also work on still bending the cost curve. And I think we're hopeful. I think all of us want certainty. And, you know, the uncertainty is the hardest part to navigate.
But that's the whole thing. I mean, your business, one of your big growth parts of the business is the breast health business, mammography.
Yeah.
We're seeing more states looking to pass legislation that mandates that 3D mammography be covered by private insurance.
Yes.
As opposed to...
New York State just did that.
New York State says, look, let the private insurers pay for it.
Yes.
What do you think about that? I mean, I know United Health has changed, right? They will now cover.
Yeah, what's been great is, you know, you've been on the leading edge of it for a while, Maria, and with our 3D, which is absolutely the biggest breakthrough in mammography detection, you know, in at least a decade, probably ever, you know, far better detective of early cancers, a huge reduction in false positives, therefore we're not having to go back and get, you know, biopsies when they're not needed. So what's been good, we've really been taking a two-pronged approach. CMS started to reimburse it, gave, you know, additional coverage about 2 years ago. Some of the private payers were a little slower. And then Governor Cuomo just recently in New York, Connecticut has mandated that all insurers must cover it. So what's been nice now is the private insurers are starting to really get on board. Blue Cross was there, Cigna's there, and just recently Anthem and United in the last month are now covering it. So that's really taking us to the next level.
That's great.
From the point of breast health, does the 3D mammogram eliminate the need for a sonogram or an ultrasound? And what's the price differential between a standard mammogram and a 3D mammogram? Yeah,
in most cases, you know, I can't get into being a doctor's, you know, Dagan, but that wouldn't have worked out too well.
But how would doctors use 3D
Generally,
mammography?
the 3D mammography is going to show so many things that they could never detect in 2D.
Okay.
So that it is dramatically reducing the amount of callbacks, where, for example, people with dense breasts or other things that they might have automatically defaulted to an ultrasound,
right,
you can now see so much more with the 3D than what you could in a 2D. So it is dramatically reducing. I think that's why a lot of the private insurers, actually, as they've started to look at the longer-term economic benefits, they're seeing there's far fewer need for follow-ups.
Right.
Wow. Because you can see so much more up front. And that's really what's been the final catalyst. It's the federal government gave an additional $57 reimbursement charge based on that exact being able to reduce the biopsies and reduce follow-ups. So basically institutions get a $57 additional payment if you use 3D versus 2D. Huh. And that's actually saving the system money.
Steve, you were saying that, you know, companies in healthcare want some certainty. And, you know, Obamacare was passed with no Republican votes. Now it looks like whatever replaces it is going to be passed with no Democratic votes. And, you know, you get this possibility for fairly significant changes in policy. You know, how are you thinking about that as you try and plan for the future?
You know, certainly our dream would be that both sides could come together, because I think the big risk that you highlight is if you, every 4 or 8 years, if we're bouncing back and forth from one side to the other, that's not going to be good for all of us either. It's not good for, you know, frankly, citizens. It's not good for business. So, you know, my dream would be that we can actually come together and, you know, get a policy that, or, you know, really an act that both sides could ultimately support.
What do you say to people who push back and talk about not just the people who are included in this new bill, but those who are excluded? You know, the Congressional Budget Office put out new numbers just last night that showed us, you know, unfortunately, despite changes that have been made to this proposed piece of legislation, we're still at that 24 million new uninsured people, Americans. How do
that will lose
kind
their
of talk
coverage.
that will lose their
million.
coverage? Yeah, new people who will lose their coverage. So how do you kind of talk to people about that? What do you think?
Yeah,
the politics aside.
Yeah, to me, just as a citizen of, you know, a country with our kind of wealth, let's face it, I think one of the very good things about Obamacare was trying to get more people into the system. And I think at the end of the day, you know, what's fascinating to look at the rest of the world, most of the rest of the world that's had government-provided plans, they're all going bankrupt, and they're all effectively trying to get more private pay into the world. I think at the end of the day, we need a common-sense solution where there's a little bit of a government floor, but then you let the market drive so much of the rest of health care. But we do, you know, we've got to provide some basic level coverage.
Just to be clear, though, the 24 million, those are people who will choose not to buy health insurance.
That's right. They're not losing health insurance.
Again, it's because the mandate from the government goes away. So that, again, it's like, are you going to be...
a few years ago who did not have health insurance?
They're going to not
There was a mandate that you had to pay if you didn't have the insurance.
Right. So
it's such an important point that you bring up, because the mainstream media is saying, oh, yeah, this plan is going to kill all these people, and they're not going to have... They're going to choose not to have insurance.
Right. Exactly.
Yeah,
before you go, really quick, Stephen, I know you just did a deal with Cynosure. You acquired this company. This is aesthetic.
Yes. It's,
tell us about this, because you think this is a big growth story.
Yeah, they're the global leader in aesthetic-based laser treatments. So, and if you think in real three simple terms, there are three broad uses for lasers, which has become fascinating. I've learned more about lasers in the last couple of months. But, you know, one is just simple skin revitalization. So everything from pigmented lesions, acne scars, wrinkles, you know, things now that you can treat with wrinkles, tattoo removal. A second area is a product called Mona Lisa Touch, which is really for vaginal rejuvenation. So menopausal symptoms, breast cancer survivors, you know, frankly, you know, women who've had hysterectomies, a lot of issues there that can now be treated with lasers, non-invasively, wonderfully. And the biggest product they launched about 15 months ago is this product called Sculpture, which is non-invasive body contouring. So effectively, we can go in with a laser right underneath the skin and start to zap out fat cells. So you can...
I like that. Zap it out, baby. Zap it out.
You can go in on your lunch hour.
We can sign up
yeah, actually, I was there yesterday. I asked them if I could get one. So it's literally a 25-minute treatment.
Wow.
So instead of the old days of lipo and everything else, and that's what lasers are really bringing to the healthcare field, is the ability to start to do things less invasively, faster, and make it far more accessible. So we think this is a market that's just in the early stages of taking off.
Let's say it's a $2 billion market. You could just run into a clinic and get this stuff done.
It'll be totally different. You know, it's totally different than the traditional days of liposuction or things like that, where you have anesthetic and recovery times and everything else. This literally... do it at your lunch hour.
Wow. I was going to say, what are you guys doing for lunch?
Yeah, exactly. We'll be watching that. It sounds like a real
Not that you need it. None of you need it.
Great to see you. Thank you so much.
Maria.
Stephen MacMillan is the CEO of Hologic. Coming up.